We're going to talk about another inflammatory concept. This is known as what? Tendonitis. Earlier we spoke about bursitis, okay? Osteoarthritis. Anytime you see itis, they are simply talking about what? Inflammation. All right. So tendonitis, from the word tendonitis, you can actually what? Bring out the word tendon. All right. So what is a tendon? Tendon is where a muscle is ending so that the muscle wants to now join with a bone. So tendons actually connect muscles to bones. So if there's inflammation of this connection, they add itis. So tendonitis. So for definition, tendonitis is also known as what? Tendinitis. It's an inflammation or irritation of a tendon, which is a thick, flexible cord of tissue that connects muscles to bones, just like I've explained. Characteristics. Most common locations you find inflammation of tendons in areas like the shoulders, the elbows, the wrists, the knees, and the heels. Okay. Symptoms. If there's inflammation of the tendon, there will be pain, there could be tenderness, there could be mild swelling near the affected joint. Okay. So the pain is often described as a dull ache pain, especially when moving the affected limb or joint. Okay. Causes. It could be that you repeatedly move that joint. Okay. So activities involving repeated movement, overuse of the joint, such as gardening, painting, playing sports like footballers, basketballers, and all of that, cause your joints to cause the tendons to become inflamed. Injury. If there's a sudden trauma or sudden injury to the tendon. Age. Tendons become less flexible with age, increasing the risk of tendonitis. Underlying conditions like osteoarthritis, diabetes, and gout can actually contribute to the development of this tendonitis. So diagnosis, you could do physical examination, where a doctor will actually examine the affected areas for signs of inflammation and tenderness. Imaging tests like X-rays, ultrasound, MRI, all of this can be used to confirm the diagnosis and rule out other possible conditions. So treatment of tendonitis is mostly you have to rest and stop moving too much. Okay, so possibly you have to take a break from what actually caused the problem. Okay, so avoid activities that aggravate the condition and using splints or braces just to immobilize the joint. Medications. So you can use NSAIDs. These are the non-anti-inflammatory drugs just to reduce the pain and inflammation in some cases. Corticosteroids injections may be administered. The physical therapy. You can do some exercises to strengthen the muscles around the joint and improve flexibility. Surgery. Rarely surgeries may be needed, okay, to repair a torn of the tendon. Prevention. Use proper technique and equipment during activities. Stretching and strengthening. Regular stretching and strengthening activities just to maintain joint flexibility. One funny thing is this tendonitis could also be due to no activity and all of that. You get. So ergonomic adjustment. Make ergonomic adjustments to workspaces and tools just to reduce your strain on the tendons. Okay. So that's it for tendonitis or tendinitis.